Doctors and experts are warning the number of people without health insurance is rising due to the pandemic. Migrants are particularly affected, but there is also an increase among nationals from the middle class. It is happening across the European Union, including here in the city of Vienna, where, for instance, the number of uninsured pregnant migrants has risen by 30%.
I was working, but I lost my job because of the coronavirus pandemic. With that, I lost all my entitlement to health insurance. I lost everything.
In Austria, health insurance is linked to employment. Without a job, pregnant Elina is dependent on the help of volunteer doctors. In order to cope with the increase in patients, the Viennese outpatient clinic Ambermed is now looking for reinforcements.
Yes, the patients are glad that we exist. They're happy there's the possibility of this clinic here with low threshold access, where actually anyone can come. The only condition, so to speak, is not to have insurance. I think our work here is very important, and that's why I'm part of this.
In many other European countries, health insurance is linked to citizenship or residency, so officially everyone is insured. In Austria and Germany, healthcare coverage has been extended in recent years and only a small percentage remain uninsured. The largest share of those without insurance are in Poland, Hungary and Estonia. The pandemic is now worsening the situation. In the last year, unemployment rates were higher among foreign than native-born in almost two-thirds of the OECD countries.
The number of people coming to institutions that treat people without health insurance has risen dramatically. And above all, people with a migration background are affected, people who are already per se more likely to not have insurance. But now they're even more so because they are often precariously employed and are the first to be affected by unemployment in the context of the pandemic.
Elina's corona-related unemployment shows the gaps in Europe's health insurance systems. But Elina wants nothing more than to find a job, any job, and for her child to be born healthy. Johannes Bleschberger, Euronews, Vienna.